Geriatrics is the assessment and treatment of disease in someone who is 65 years or older. That's it.
Okay, go.
It is important to understand and appreciate how the life of an older person might differ from yours. You will see older people who have recently lost a spouse and are struggling to fill the spouse's role. Oh, hey there. I didn't see you there. Such by managing the finances and doing the housework, many older people also live on a fixed income, which can be very challenging. Some older people may not know to take all their medications in an effort to save money. Many fear losing their independence and not being able to live on their own home.
Go.
Effective verbal communication skills are essential to the successful assessment and treatment of older patients. Oh, hey, nice to see you again. Did you know communication with older people can be challenging? The aging process brings with it changes in vision, hearing, taste, smell, touch, and pain sensation. Also, there are changes in communication abilities that accompany aging, such as dementia and other diseases. Leading causes of death include heart disease, cancer, injury, chronic lower respiratory disease, stroke, Alzheimer's disease, diabetes mellitus, injury, influenza, and pneumonia. Wait, what happened to my voice? Age-related changes in the respiratory system can predispose in older adults to respiratory illness. Even a minor lung infection can become a life-threatening event. One of the conditions contributing to breathing problems is the weakening of the airway musculature that can cause decreased breathing capacity. This decreased muscle mass means that older patients have less health for muscles in the chest wall when they have trouble breathing.
Several pathophysiologic changes can cause older people to be susceptible to toxicity. These changes include decreased kidney function, altered gastrointestinal absorption, and decreased vascular flow in the liver that alters metabolism and excretion.
The use of medications by older people accounts for 1/4 of the prescribed medications and 1/3 of over-the-counter medications sold in the United States. Typical OTC medicines used by older people include aspirin, antacids, cough syrups, and decongestants. For most older people, the later years are ones of fulfillment and satisfaction with a lifetime of accomplishments. For some older adults, however, later life is characterized by physical pain, emotional distress, doubts about the significance of life's accomplishments, financial concerns, and loss of loved ones. Hold on to care for older patients. It is important to remember certain key concepts. The GEMS diamond was created to help you remember differences in older patients compared with the rest of the population. The GEMS diamond is not intended to be a format for your approach to geriatric patients, nor is it intended to replace the XABCs of care. Instead, it is an acronym for the tissues to be considered when assessing every older patient. In GEMS, the G stands for geriatric patients, the E stands for environmental assessment, the M stands for medical assessment, and the S stands for social assessment. Many older people try to maintain their independence as long as they can. They may or may not have someone who checks on their welfare. You will find some people living in conditions that are not safe or appropriate. You need to take note of negative or unsafe environmental conditions. Is the home well maintained and sanitary? Are the utilities working? Look for clues that might explain to the patient's medical history or current problems. Patients. In general, the risk of serious injury or death is more common in older patients who experience trauma than younger patients. Slower homeostatic compensatory mechanisms, limited physiologic reserves, normal effects of aging on the body, and existing medical issues create risk and complicate the assessment of geriatric patients. During the primary assessment, you will address life threats, determine whether this is a priority patient, and to which facility the patient will be transported. Because older patients older than 55 years old have an increase of major injuries and death, it may make good sense to transport older trauma patients to a trauma center. Once you have determined that the patient has a potentially life-threatening condition, limit any on-scene treatment to that which is absolutely necessary for patient stabilization. Follow your local protocols.
Remember now, response to nursing and skilled care facilities. For many of the geriatric patients with whom you interact, the call will occur at a nursing home or other skilled care facility. Relatively healthy and active seniors often live in the age-restricted apartments that provide seniors with the physical and emotional security that comes with living with other seniors.
Currently make use of an advance directive, also called living wills. Advance directives are specific legal papers that direct relatives and caregivers about what kind of medical treatment they may be given to patients who cannot speak for themselves. Dealing with advance directives has become more common for EMS providers because more people are electing to use hospice services and spend their final days at home. Elder abuse and neglect. Trauma in older people can also be, trauma in older people can be caused by abuse reports, complaints of abuse, neglect, and other related problems. Among the nation's older population on the rise, elder abuse is defined as any action on the part of older patients, family member, caregiver, or older associated person that takes advantage of the older person's person, property, or emotional state. The exact extent of elder abuse is often not known for several reasons, including the following, such as denying an older person adequate nutrition or medical care. Words of wisdom. As with other legally complex and emotionally charged issues, the possibility of elder abuse demands particularly careful documentation. Be thorough, objective, and factual. Avoid unsupported opinions and personal judgments. You may be called to explain your report in legal proceeding. Report your suspicions to the appropriate authorities and follow local protocols. Typically, the authorities will want to know specifics about the person you suspect is being abused and why you suspect abuse.
Where are they?